In case no one's told you, your BPD symptoms are coping mechanisms. Let's unpack that. The core symptoms of borderline personality disorder are essentially maladaptive coping mechanisms developed in response to things like chronic emotional pain, invalidation, and/or childhood trauma. These symptoms are the ways a person tries, unsuccessfully usually, to manage intense, overwhelming emotions and protect themselves from perceived danger or abandonment. So we're going to look at the BPD criteria per the DSM-5 and how they're directly traceable to attempts to cope with emotional dysregulation and a history of trauma. So the first one is fear of abandonment and unstable relationships. This is a frequent BPD symptom and the direct fallout of relational trauma and neglect. So the trauma origin is that the person's earliest, most important relationships were inconsistent, unreliable, and/or abusive. They learned that the people they depend on for safety will eventually hurt or leave them. The coping mechanism they developed is an intense and persistent fear of abandonment, which leads to frantic efforts to avoid real or imagined separation from other people. This causes them to cling to people or push them away prematurely, ensuring, unfortunately, that then all relationships end up becoming unstable. Number 2 is identity disturbance and chronic emptiness. So trauma and chronic invalidation prevent a child from developing a stable, cohesive sense of self. The trauma origin is if a child's feelings and experiences are constantly dismissed, like you're just making that up, or you don't really feel that way, or you're just exaggerating. What happens is they never learn who they are or what their feelings mean. They're just told not to have them, basically. So their identity is dictated by the needs of their environment. The coping mechanism they develop is an unstable self-image and a profound, painful sense of chronic emptiness. They constantly try on new roles, behaviors, or beliefs to fill that void or figure out who they're supposed to be. Number 3 is affective instability or emotional volatility, so the ups and downs. This is the primary evidence of the underlying emotion dysregulation resulting from the biological vulnerability combined with the invalidating environment. So the trauma origin is the person's intense emotional responses were never validated. They weren't labeled, they weren't taught how to be regulated, so they lack the skills to modulate feelings that they naturally experience more intensely than others. So it's like insult to injury. The coping mechanism that they often developed is their emotions change rapidly and intensely, like intense anger, deep depression, or anxiety that lasts several hours. They're essentially cycling through emotional crises because they don't have the mental tools to calm their nervous system. The fourth one is impulsivity and self-harm. So these are often the most visible and sometimes desperate attempts to escape emotional pain. The trauma origin is in overwhelming, intense negative emotions that feel intolerable and inescapable. The coping mechanism they develop is like impulsivity, so reckless spending, maybe binge eating, risky sexual behavior. It's a quick, temporary fix used to distract from or numb the emotional pain. Another one is self-harm or suicidal behavior. So this is a powerful, learned strategy to regulate overwhelming emotional states. For some people, the physical pain is easier to manage than the emotional pain. For others, it's a way to signal distress when words fail or to punish themselves for perceived failures. In essence, BPD can be viewed as a series of survival tactics that made sense in a traumatic environment, but become destructive in adult relationships and life. So at some point they made sense or else you wouldn't have done it, right? The goal of treatment, particularly dialectical behavior therapy or DBT, is to teach new, effective skills to replace these old, painful coping mechanisms. Now, if you want help with these and other challenges of BPD, be sure to subscribe to my BPD skills training group where we're tackling all of this and more.